Welcome to today's Explainer. Honestly, I am so excited to guide you through some truly groundbreaking information today. We're going to be looking at a fascinating and, frankly, incredibly vital lecture by Dr. Naoya Yamazaki from the National Cancer Center Hospital, and it's all about rare skin cancers. So let's just dive right in, shall we? Did you know that skin cancer doesn't even make the top 10 list of most common cancers in Japan? It usually ranks somewhere, between 10th and 15th. Because of this, it's actually considered a rare cancer, and because of that, accurate and empowering information can be just frustratingly hard to find for patients. But there's a massive shift happening right now. We're seeing changes both in how often these cancers are popping up and, brilliantly, in how we're actually treating them.
And that brings us to a pretty alarming reality. 2 times between the years 2000 and 2010, the number of skin cancer cases in Japan literally doubled. And then, get this, from 2010 to 2019, it doubled again. It's basically compounding exponentially. Now you might be wondering, why is that? Well, it's primarily due to an aging population, combined with intense summer heat and UV ray exposure. So while it's technically classified as rare, the threat is undeniably rising. And that makes it more critical than ever that we understand exactly what we're dealing with.
To make sense of all this, here is our roadmap for today. Number 1, the rising threat of rare cancers. 2, understanding melanoma in Japan. 3, the paradigm shift in cancer treatment. 4, breaking down other major skin cancers. And finally, number 5, patient empowerment and the future.
All right, starting off with Section 1, the rising threat of rare cancers.
So let's break down what doctors refer to as the big 3 skin cancers. At the top of the list, we've got basal cell carcinoma. This one affects around 12,000 people annually in Japan. Next up is squamous cell carcinoma, bringing in about 8,000 patients. And finally, we have melanoma, with roughly 2,500 to 3,000 patients a year. Now, what's absolutely crucial to grasp here is the demographic. When you look at the medical data, the peak age for these diseases is strikingly consistent. They overwhelmingly affect the elderly, specifically folks in their late 70s and 80s. Now, melanoma does skew just a tiny bit younger, kind of peaking in the 60s, but across the board, these are diseases heavily tied to aging and accumulated exposure over a lifetime.
Moving on to Section 2, understanding melanoma in Japan.
Okay, this is where things get really fascinating, because there's a vivid racial and geographic difference when it comes to skin cancer. For Caucasian populations in places like Australia or the US, melanoma is highly linked to UV exposure and mostly appears right there on the superficial skin. But for Japanese and other Asian populations, it is a completely different story. The highest percentage of cases actually appear on the soles of the feet or right under the nails. And, even more startling, roughly 20% of Japanese cases occur in mucous membranes. We're talking inside the nose, in the mouth, the esophagus, or even the genital tract. And because it hides in these, unseen places, about 30% of Japanese patients already have lymph node or distant organ metastasis by the time they're actually diagnosed. It's tough.
So the big question is, how do we catch it early? Well, dermatologists rely on a highly effective tool called the ABCDE rule. You're basically looking for an asymmetrical shape, a jagged border, mottled color, a diameter larger than 7 millimeters, and a spot that is evolving or growing rapidly. If a spot on your skin fits that profile, you need to see a doctor right away. No waiting around. But here's the catch that Dr. Yamazaki really stresses. If that melanoma is growing inside your nasal cavity, you're obviously not going to see those ABCDE warning signs, right? And this is exactly why spreading awareness, not just to patients, but to general practitioners, ENT doctors, and gynecologists, is absolutely critical to improving early detection rates in Japan.
This brings us to Section 3, the paradigm shift in cancer treatment, how Opdivo changed everything.
Let's take a quick look back at the history of treatment here. Decades ago, the default response to skin cancer was, massive surgical excision. It's a bad cancer, so surgeons would just go in and take out as much tissue as possible, which unfortunately often left patients with severe swelling or numbness. But over time, the medical field started to realize that aggressive surgery wasn't always improving survival rates. The real revolution hit exactly 10 years ago, back in 2014, with the introduction of this incredible immunotherapy drug called Opdivo, also known as nivolumab. Starting with melanoma, Opdivo completely changed the landscape of cancer treatment. It was a real game changer. And just this year, in 2024, its approval was vastly expanded in Japan to cover a much wider range of surface skin cancers.
So, the crucial point here is understanding how these modern drugs actually do their job. Today, doctors basically have 2 main pillars of medicine to work with.
On one hand, we have targeted therapy. Now, this works for about 25% of Japanese patients who have a very specific genetic mutation called BRAF. These drugs are incredible. They work fast, and they shrink tumors in roughly 2/3 of patients. But cancer is smart, isn't it? After about a year and a half, the cancer cells can build resistance, and the drug kind of loses its edge. On the other hand, we have immunotherapies, like Opdivo. Now, these are slow-acting. They aren't going to give you that immediate, overnight tumor shrinking satisfaction. However, if the immunotherapy works for the first 2 years, it tends to offer incredibly long-lasting, durable effects that can keep the cancer at bay for years to come. So doctors today have to masterfully balance these two approaches.
And this brilliantly illustrates the whole new mindset in oncology, perfectly captured in a quote from Dr. Yamazaki. The old goal was to hunt down and completely eradicate every single tumor, whether it was the size of a baseball or a tiny pachinko ball. But today, the philosophy has totally shifted. If you have a 1 centimeter shadow on your lung, but you aren't coughing, you aren't short of breath, and the immunotherapy stops it from growing, well, that is a massive victory. The goal is no longer just eradication. It's about successfully managing a symptom-free, high-quality life.
All right, Section 4, breaking down the other major skin cancers. First up on this list is basal cell carcinoma. This is a black cancer, highly common in the elderly, and it mostly appears from the neck up. But here's the great news. 99% of the time, it doesn't spread. It can be completely cured by just surgically removing it with a tiny 4 or 5 millimeter margin. Next up is squamous cell carcinoma, which is the most common red cancer. Fun fact, historically, this was actually the very first cancer proven to be caused by chemical exposure, specifically soot from chimney sweeps back in the day. Wild, right? Today, it's mostly caused by UV exposure or chronic inflammation, like from severe burn scars. But just like basal cell, it is highly curable. About 90% of cases are cured with surgery, but if surgery isn't an option, doctors can successfully use radiation or even topical creams.
Now let's quickly look at two much rarer cancers, both named after the doctors who discovered them, actually. First, Paget's disease. This often occurs in areas with sweat glands, like the genital region, and it spreads incredibly slowly across the surface of the skin. The real danger here is misdiagnosis. Because it looks just like regular eczema or a rash, it can sometimes take years for patients to get properly diagnosed. But the massive breakthrough? Opdivo is now finally available to treat it. Then there's Merkel cell carcinoma. This one is sometimes triggered by specific virus. It presents as a red lump, and it's often mistaken for just a swollen lymph node. Until recently, there were literally 0 drug options for this. None. But a new immunotherapy called avelumab was recently introduced, and it is showing some remarkable results, proving effective for about 2/3 of patients who are using medicine for the very first time.
And finally, Section 5, Patient Empowerment and the Future. You are not fighting alone. You know, when you're diagnosed with a rare cancer, the internet can be a genuinely terrifying place. It's just filled with urban legends and unverified rumors that can really mess with your head. And this is exactly where patient advocacy groups become absolute lifesavers. Groups like Over the Rainbow, which was established in 2013 for melanoma patients, and Sasakai, formed in 2021 for Paget's disease, act as vital traffic controllers for information. But they do so much more than just support patients emotionally. Dr. Yamazaki emphasized that these groups actively collaborate with doctors to write the actual standard of care medical guidelines. They ensure that the medical community doesn't just operate in a vacuum, making sure treatments actually align with what patients need and hope for.
Dr. Yamazaki ended his lecture with this deeply empathetic message. He acknowledged that, hey, while doctors try their absolute best, they just can't answer every unasked fear in a brief 10-minute consultation. His plea to patients and their families is really simple. Don't shoulder the anxiety by yourself. Lean on the patient communities, rely on accurate, vetted information, and work as a team with your medical providers. The entire medical community is actively fighting on your side, and the rapid advancements in immunotherapy absolutely prove that.
Which leaves us with this final thought for today. We've seen that early detection, knowing your ABCDEs and paying close attention to unusual changes on your skin, your nails, or your soles is your absolute best defense. Science is advancing at lightning speed right now, turning what were once devastating diagnoses into manageable, long-term conditions. So are you keeping an eye on your own skin? And more importantly, are you empowering yourself with the right knowledge? Thank you so much for exploring these incredible medical breakthroughs with me in this explainer. Keep learning, stay proactive, and always take care of your health.